Hi, I'm Michael from Planet Naturopath, and today we're going to talk about hormones, and in particular, hormones that affect men. So guys, whenever you think about hormones, you always think about testosterone, but we have other hormones like estrogen, cortisol, insulin, thyroid hormones, and these all interact with each other and can end up leaving you feeling fantastic and great, or lead to weight gain, poor recovery, a whole range of symptoms. So let's have a look at the hormones and I'll explain which hormones affect what, how the best way to test, and the different symptoms that they can cause. So for a lot of guys, when they think of low testosterone, they'll think of things like low libido and erectile dysfunction. But low testosterone can also cause things like infertility, which can lead to things like performance and anxiety. Low testosterone, high estrogen, and also combined with high cortisol can lead to weight gain, especially around the waist and breast, leading to man boobs, muscle weakness, poor recovery from exercise, and not getting the results from the training that you're doing. Depression, low mood, or mood changes from angry to sad, and low motivation and fatigue. These are all the signs of hormone imbalance. So the hormones that can be out of balance are testosterone, 5-alpha DHT, which is a more androgenic version of testosterone, and that can lead to prostate problems, hair loss. High estrogen, which can lead to the man boobs, weight on around the waist. High cortisol is a similar sort of thing, can lead to anxiety, poor sleep, weight around the waist. Low cortisol is the opposite, it's burnout, exhaustion, fatigue. And high insulin, similar to high cortisol, will lead to the weight on around the waist. And this guy is probably a picture of someone with low testosterone and high estrogen and more likely high cortisol. So this is a map of the hormone pathways. It might look confusing, but from cholesterol, your body will make something called pregnenolone, and that can go down this pathway to make DHEA, which leads to testosterone. But when there's a lot of stress, this pathway gets blocked and the body will make more cortisol. This can also lead to an upregulation in the production of estrogen. And that's something that guys need more. They don't need more estrogen, but they need some, not excessive amounts of estrogen. This is a simpler version of this pathway from cholesterol. DHEA will be blocked if there's a lot of stress, leading to more cortisol. And you can also get this upregulation of the pathway to make estrogen, which we don't want. So let's have a look at the Dutch hormone test. This is the test that I recommend. You can do blood tests, saliva tests, but the Dutch test gives the most information and helps to uncover the underlying cause of what's going on. This is a guy with high estrogen levels and also high total cortisol. This one has low testosterone, 31, and ideally you want to be in like the 70, 80 plus range. And the estrogen is also a little bit on the higher side, and it's not getting metabolized down the right pathway. So that can lead to things like prostate cancer in the future. So this is a person on testosterone replacement therapy. So their testosterone is off the charts, but so too is their estrogen and the way it's getting detoxified, and also the 5-alpha DHT. So this is where testosterone replacement therapy is not always the answer, because it can lead to high levels of estrogen, so you start getting all the man boobs and symptoms of high estrogen levels, which can be mood changes, fluid retention, everything you don't want when you're trying to take testosterone. Here's an example of high levels of 5-alpha DHT, poor estrogen detoxification, and that, once again, it can lead to prostate problems and prostate cancer, benign prostate hyperplasia. Here's an example of the Dutch test showing the high cortisol levels. This is high total cortisol and high free cortisol. This can be both from physical stress, like not sleeping, overtraining, not training enough, infections, illness, to emotional stresses like relationships, work. The Dutch test also measures these organic acid markers for B12, B6, detoxification, neurotransmitter metabolites, melatonin, and oxidative stress. And these can all influence the sex hormones and adrenal hormones, which is why we test these, and it can help to look at how the hormones are affecting other parts of the body. The Dutch hormone test can be ordered at the website planetnaturopath.com Dutch test, and we can ship the tests all over the world. Consultations are via video or phone, so it doesn't matter where you are in the world, we can organize a consultation to explain the results and help you with a treatment plan.